This was in 1991, when most Indian entrepreneurs were busy exploring the possibilities of making a quick fortune out of their investments. Meera Satpathy, already a successful businesswoman by then, was thinking differently. She was deeply disturbed by the challenges faced by people, specifically mothers and children living in the unreached villages and slums around Delhi, with no access to primary healthcare services and basic needs of life. Furthermore, she foresaw greater challenges ahead due to rapid urbanization. With the support of a few like-minded people, she founded Sukarya in 1998, with a mission to empower the underprivileged living in the villages and slums in Delhi, Haryana and Rajasthan, and provide them with quality primary healthcare services. Sukarya was born with the mission of improving maternal child health, reducing infant mortality rate and empowering women as the key fundamental and development issues being foreseen by Meera much before the declaration of UN Millennium Development Goals in 2000. In all her endeavors, she had been focused on saving lives of women and children and bringing about a change in society by improving its mindset and attitude to basic healthcare in sync with the National Rural Health Mission of Government of India. This vision was the driving force for all projects, providing basic healthcare that includes institutional delivery, prenatal and postnatal care, and addressing the issues of immunization and malnutrition condition like anemia, etc. In collaboration with Population Foundation of India, the project on intervention study among adolescents, pregnant and lactating mothers to reduce prevalence of anemia, a contributory factor of maternal morbidity and mortality, was introduced in 15 villages, followed by knowledge-based intervention in reproductive health advocacy and action in 30 villages, serving 90,000 people living in 18,000 households in Mewat. Another project in collaboration with Power Grid of India for improving mother and child health through specialized clinics was introduced in 2012. Formation of the Women's Economic Empowerment Program through SHG, self-help groups, began with encouraging such women to take charge of their lives. As a humble beginning, few village women were trained for producing cereals and spices using quality ingredients, which are still continuing to be sold locally. The initiative has been a huge success and has become the foundation of a highly successful women's economic empowerment program. Another exciting milestone was the launch of the Integrated Rural Health and Development Project (IRDP). This pilot project was implemented in Mangair village, designed to reflect an integrated approach towards health and sanitation, education, economic empowerment of women. This model was later replicated in 3 other backward villages of Rajasthan in 2016. The Urban Slums Health Action Program was launched in 10 slums in and around Delhi to tackle malnutrition and anemia amongst mothers and children through comprehensive approach. Currently, this program has been immensely popular among the community living in the slums, serving a population of nearly 100,000 people with 20,000 pregnant and lactating women and 4,000 children. The Education on Wheels project introduced non-formal education to the children living in urban slums by bringing school to them, thus providing them access to basic education, granting them opportunities for a better life. The project has been highly successful with measurable outcome by majority of children qualifying for OBE, Open Basic Examination, and securing admission into mainstream schools. The last 18 years has been a beautiful journey for Sukarya, with many milestones, enriching and impacting thousands of lives. The objective was simple: to be able to bring quality health care to the underprivileged and the needy. The noteworthy impacts were implementing interventions in areas where access to quality healthcare was non-existent. Built and strengthened linkages with the government health system. Empowering rural women through self-help groups and introducing them to entrepreneurship program for grinding, processing and packaging of spices and cereals. Getting the communities to take ownership of the programs and change the attitudes of people to become active partners and not passive spectators. Ensuring smooth execution of its programs and services by having full support from the villagers, stakeholders, community leaders, religious leaders and sarpanchs, village heads. Making change a way of life, be it the use of iron kadahis for cooking food or the delivering of a newborn with the help of skilled birth attendant or a woman working for economic independence, or training community health workers CHW to become the permanent agent of change for the society they live in. Sukarya has been an accredited member of Credibility Alliance for Desirable Norms. It is also empaneled on the Indian Institute of Corporate Affairs IICA and National CSR HUB Tata Institute of Social Science. Our international partners. The project Health Education and Livelihood Program was implemented in 30 villages of Mebat in collaboration with Freedom from Hunger India Trust, an affiliate of Freedom from Hunger of USA. Sukarya is currently in collaboration with Enactus, a US-based non-profit promoting entrepreneurship through self-help groups in the villages near Gurgaon. A strategic collaboration with Arman's N Mitra voice call program and MAMA, a global alliance of Johnson & Johnson UN Foundation for its maternal and child health program to reduce maternal and infant mortality and morbidity in urban India. Currently, the program is in operation in 4 districts of Haryana and slums of Delhi, serving 60,000 pregnant and lactating women. A huge recognition was accorded to Sukarya in June 2016 when its founder, Meera Satpathy, was nominated for and invited by the United States of Women's Summit convened by the White House in Washington, D.C. The purpose of the summit was to celebrate that women and girls have achieved and how the women leaders were taking action to move forward, covering key gender equality issues in order to make a powerful difference in our collective future. Another milestone for Sukarya was achieved when Sukarya, USA was incorporated as a non-profit in the state of Washington in the United States with the purpose to support the mission of Sukarya in India. In 2017, Sukarya became one of the non-profit partners of the Global Giving Foundation.